Even before the pandemic, nearly 1/3 of Ontario doctors were reporting high levels of burnout. A new report by the Ontario Medical Association finds that number has gone up this year. One physician warns if the situation worsens among our doctors, we will all feel the impact when it comes to our care.
We've called healthcare workers heroes, and especially our politicians and people in power have said that repeatedly, but we have not been treated like heroes.
A new OMA survey finds 73% of physicians who took part experienced some level of burnout this year, up from 66% last year. Just over 1/3 reported either persistent symptoms of burnout or feeling completely burned out. That number has gone up as well.
Physician burnout has actually been associated with increased depression amongst physicians, substance use disorders, and even suicidal thoughts. It could also lead to decreases in productivity, increased turnover, and really possibly decreased patient access to care.
The survey finds the top reasons for burnout are technology and the fact that many physicians spend more time completing required documentation than caring for patients. Doctors we spoke to say there are a number of other obstacles.
It's important to emphasize that this existed before the pandemic started and has only been exacerbated by the stress of dealing with patients with COVID, worrying about getting COVID yourself, worrying about how to manage the work and home life balance. Are you going to get infected and bring this home?
Staffing shortages are everywhere you look. People are not receiving essential protections like N95 masks. And on top of this, health workers have had to witness unbearable and preventable suffering and death throughout this pandemic, whether it was people living in long-term care homes for the first and second waves, or whether it was essential workers during the third wave.
Dr. Arya says we need to dig deeper into the root cause.
Why are health workers developing PTSD and anxiety in the first place? What are the working conditions and what are the material conditions of the patients that they're seeing? So we have a system which honestly grossly underfunds healthcare in our province.
The report included 5 recommendations when it comes to assisting with the issue of doctor burnout, which includes more of a work-life balance, improving digital health tools, and providing mental health support for physicians in their workplaces. For City News, I'm Maleeha Shiekh.